Awesome. Thank you so much for joining me today. I don't know if Eric told you, my name is Jennifer Mendoza. I'm currently an intern for the Washington State Public Health Association.
Yeah.
And so I just wanted to interview you guys, ask you some questions about your organization. I really love what you guys are doing, and I think that it fits really well with our theme of food and nutrition for Public Health Week, which is going to be next week.
Yeah. Well, thank you so much for thinking of us. And yeah, I'm really glad Carolyn can join us. I can gab a lot, but she actually knows what she's talking about. So
We
No,
make
that's
a good
great.
team.
No, yeah, I really appreciate it.
yeah.
I would really like to know a little bit about you guys, what you do, and then we can go in with the questionnaire that I had sent.
Oh, you bet. Go ahead. Go ahead and go first, Carolyn.
Great. So before getting into community work, I worked in healthcare IT, and I started having a lot of health problems that led me to go to the doctor, and they recommended a dietitian. And so I started thinking about food in a different way. And I thought, hey, this is really exciting. I love food. I love people. Maybe I could do something like this too. So I went back to school to become a dietitian. And here I am now at Second Harvest. I teach community cooking classes and also work on data reporting and fundraising and kind of just lots of things that keep the kitchen going and help us serve the community.
Awesome. That sounds awesome. Yeah.
Yeah. My story is much longer and less inspiring than Carolyn's, but so when I first got out of college, I was a newspaper reporter for about 10 years, and then actually worked in the natural resource industry, mining, oil and gas, energy, all the stuff that people need but don't want in their backyard. I worked on a lot of that, and some large agricultural projects. And then shortly before coming to just not quite 3 years ago, coming to Second Harvest, I worked in DC for what's called the Nuclear Energy Institute. So, but I'm glad DC is a wonderful place to visit. It's not a good place to live. So I'm glad to be back here. And actually, not long ago, our CEO, Jason, gave us new name tags that by design do not have titles on them. So like I just tell people I'm a utility infielder for Second Harvest. Yeah. And Phil, I know you and I think talked a little bit earlier, but go ahead and fill Carolyn in on your background.
Yes, so I'm currently a student at Eastern Washington University. I'm about to finish like two classes. And for one of my senior classes, I wanted to intern for like an organization that dealt with public health. And so that's how I got a hold of the Washington State Public Health Association. And we are getting information and trying to inform the public about National Public Health Week. And we have different themes. And so they go from sexual health, mental health, rural health, and then food and nutrition, etc. And so, like I said, I really like what you guys are doing, and I really want, the public to know what it is that you're doing and who you're helping, because it's a lot of people that you're helping. And so that's why I reached out to Eric and now this interview. So
that's so cool. Thank you for doing that.
Yeah. Thanks so much for thinking of us. I've got the questions. Do you want me to just dive into the first one?
Yeah. So what is Second Harvest and what are your missions and values?
Yeah, so I'll send you our mission statement. It's very short. It's very direct. Serving people facing hunger, and then a few more words. And another way that we sometimes put it, when somebody asks, "Well, who do you serve?" and I typically say, if you or someone you love is hungry, we're going to do everything we can to get you food. That's more of a challenge than ever right now with so many other factors that we're happy to discuss, but it's really difficult to get food right now. It's not only expensive, but it's really hard to get it. So we work really hard to do that. About 90% of the food in a typical year is donated. We call, and normal is not acceptable, but it's kind of the norm. We distribute about 3 million pounds of food a month, and that's across 26 counties. And so I noticed in your I think in one of your questions, you were Spokane specific. And while Carolyn and I are in Spokane, we also have a facility in Pasco, a warehouse and a few offices there. And we serve 26 counties, 21 in central, basically east of the Cascades, and then the 5 North Idaho counties. So, and that footprint is largely determined by Feeding America. So are you aware of Feeding America?
No, I'm not.
Okay, so Feeding America is and you just go on their website. It's very good. It's very easy to navigate, but it's a network of 200 food banks across the US who work together on all sorts of things, including, for example, we don't have like lobbyists in DC. Feeding America has a DC shop. And then they also do things like make it easier for us to send some apples to our sister organization in Arizona and for them to reciprocate by sending us a semi-load of citrus, so that, you know, that can help us offer more variety and other things. So it's a wonderful network for us to be in. I don't know if it may not affect this project that you're working on now, but sometime in your career, you might want to go to Feeding America. It's called Map the Meal Gap. And it's a very robust data set on hunger, percentages of hunger across the country. You can drill down to the county level.
Okay.
Yeah. So it's,
cool.
again, it's Map the Meal Gap. It's a very useful tool. Again, I don't know if that it again applies to this particular project for you, but you know, sometime in your career, I think you would find it very, very helpful. It also peels off the general population, but then also has statistics for kids 18 and under.
No, yeah, that's definitely something that we can put in.
Okay.
A link or a presentation. And
yeah. Okay.
With this, so.
Yeah. So again, I just had another interview, so I'm hoping I'm not repeating myself too much.
You're right.
But so the best way to think of us is a food bank for food banks. So actually, if someone comes to our door, either in Pasco or in Spokane, we actually don't hand out food here for all sorts of reasons that we're happy to answer. Now, the people at our front desks in both have a list of resources of here, you can go, you know, down the street to the NL King Center on these days, or across the road to UGM. But the only direct service that we have is our mobile markets.
Okay.
Which we have 300 plus of those a year, targeted to underserved areas. And that isn't exclusively to, but a heavy focus on underserved rural areas.
Oh, that's awesome.
Yeah, we have a bus that'll feed about 100 families, and then we have what's actually a modified beer truck. So it's got, you know, cooling that will pack food for up to like 300 families. Yeah. So but I can ramble on forever about it.
It sounds like you're very passionate about it, and I really appreciate that. So.
Yeah, well, a big part of my job is bragging about I don't really do much. I just brag about the good work that everybody else does. So, yeah.
And I'm sure you're a very big part of that too. So, you know, thank you for that.
So that's, and I'll send you the mission and vision, and actually it's right on if you go to About Us on our webpage, what I would send you is exactly the same thing.
Okay, that sounds great.
Yeah.
So how is your organization contributing to changing the way healthy food in the Spokane community is readily available? And I know you said that it was you serve more counties, so I guess right. in the counties that you do serve.
Yeah, I'll give you the broad overview, and then Carolyn can drill down to very specifically on the health, nutrition, that side. So one of the challenges we face is, again, the beautiful thing is 90% of the food that we get is donated, but then we can only distribute then what we get, right?
Right.
So we do everything we can to increase variety. Like I said, exchanging with our folks in Phoenix for getting citrus and that. But the food that we get is by and large very healthy, very nutritious, and also, we'll say we get a semi-load of apples, like are behind me, or a semi-load of potatoes. We rely on volunteers for all sorts of things, including doing sorts. So we get a semi-load of potatoes. We put them on a conveyor belt and volunteers will sort through, and anything that's not fit for human consumption, they take and throw off into another bin.
Mhm.
And on the sustainability side, then that is given to local farmers.
Mm.
So mostly pigs. There's some food that's okay for cattle. And then they don't use a lot, but we actually also have a worm farm outside of Spokane who takes some of our excess food. Yeah, worms don't eat a lot, but that's it's just kind of a cool aspect of it.
Yeah, that's awesome.
But and then so Carolyn can fill you in much more specifically on the healthy food part.
Yeah. So another cool thing that we have for a way that we get food is our grocery rescue program. And so through that, we connect with local grocery stores and they give us excess food that they're not going to be able to sell. And so we get some really high quality food that way. And we're able to connect them also directly with our community partners who may need food as well. And then we also have a mobile market bus program, and that serves the Spokane County area and goes to local clinics, local low-income housing sites, schools, libraries, and allows clients to choose foods that they want to take with them. And there's always a lot of produce on those buses, and it's a great way to connect people in need with food, especially when you're dealing in like a clinic setting where we're trying to make lifestyle changes to benefit their health. And then we also do something called our Healthy Pantry program. And that's where we partner with local pantries and pantries throughout the county and help them make healthy choices more appealing to clients. And so that could have things like healthy nudges, which is like pairing foods together. Like maybe clients are unfamiliar with lentils and kale, but you can make a great recipe out of that. So we provide the recipe, we bundle items together so that it's easier for the clients to choose those options. They have a complete meal ahead of them. And also work with pantries to do things like increase hours, which increases accessibility for people, makes the space appealing and comfortable, encourage pantries to provide client choice where people are able to choose all the foods that they want themselves rather than just receive a boxed distribution. And so those are just a couple of the ways that we try to promote healthy food in our community.
That's awesome. I mean, I don't think people understand how much work goes behind the scenes. You know, people just see the food, but they don't realize how much is really going into trying to get to you to like the food. And, you know, that's really awesome. Yeah. Thank you.
Yeah. It doesn't do a whole lot of good if people receive food and then don't know what to do with it.
Yeah, that is true.
So,
I agree. I agree.
yeah. So just providing as much education as we can, either directly or passing along recipes, training other people to be able to teach cooking lessons, that sort of thing.
Yeah, and you're right. I mean, people don't really know how to use sometimes the ingredients they have, but you know, when they do know, I think they really can make something really good out of it. So
Yeah.
awesome.
So I was able to attend one of Carolyn's classes a while ago, and she made guac, but not out of expensive avocados, but out of inexpensive peas.
Oh,
And it was fantastic. And
peas.
yeah, a whole lot cheaper.
Wow, that's crazy.
Yeah.
You're gonna have to send me that recipe then.
I'd be happy to.
All right. How is Second Harvest educating the public about food and nutrition?
So one of the main ways that we provide nutrition education is through our community cooking classes. We offer those twice a week at our kitchen here at Second Harvest. And so those are free to the public through generous sponsoring by Coordinated Care this year, as well as donor support and a lot of volunteer support. So in those classes, so like I said, they're free to the public. They're intended to serve people facing hunger, just like all of our work that we do here. So a lot of times these people may receive SNAP benefits or be eligible for SNAP benefits. They may receive a lot of their food from local pantries. They hear about us through local partners like the library, like other food pantries, and they come in. We go through one or two recipes together. We have these full stations set up that plug into electrical outlets. And so if I'm cooking up at the stove up front, they're cooking at a stove too at their station. And so we can have up to 20 clients at a time in these classes. We focus on recipes that are simple. We try to source food from the warehouse. And so these are foods that are available to our community, we believe. And we try to make sure that the recipes are nutritious, easy to follow, low equipment. We always talk a lot about different ways to do things besides the way we're doing it in class. And we talk a lot about ingredient substitutions. And so a lot of times recipes will have, you need these 4 seasonings. If you don't have those 4 seasonings, you can probably still make that recipe. And here's what you could use instead. Here's things that you could leave out and it would still taste great. You can substitute other vegetables, that sort of thing. We also try to reserve time to eat together at the end of class, which we believe helps build community, which is really important just for everyone, just for people as people. And then also when you're dealing with lifestyle changes, having that community around you kind of helps reinforce what you've learned. And then we also have some discussion and hands-on activities related to nutrition during each class as well. And those tie into the recipes we're doing. So for example, last week we did roasted veggie mac and cheese using whole grain pasta. And so we talked about whole grain pasta and looked at all the different parts of the grain and what you have in refined flour versus whole wheat flour, and talked about different substitutions you could make, and really just try to hype people up about the different kinds of foods that are out there that they may not have tried yet, and the various nutrition benefits. And then, like I said earlier, we also do our healthy pantry work, which helps spread the education throughout the counties that we serve. And the BOSS program also helps spread education. We do this really cool thing at our mobile markets called sampling. And we have someone who looks at what's going to be going out that day on the truck, and they pick 1 or 2 items and find a recipe that uses that food item. So yesterday, let's see, they did apple oatmeal cookies. And so there were probably apples on that truck. And this was an exciting way to use apples that people may not have tried before. And so they made a sample. And so you get the sample and the recipe as you're waiting in line to get your food. And so it just gives you like a little sneak peek and encouragement to try something new with the food that you're receiving.
See, I didn't know that. I feel like it's very interactive. You said you're building community, and I think that's very important for people, especially when they feel like they're struggling.
Yeah.
And I think food is a very important topic. You know, people think food is just food, but it brings a lot of communities together. So it's very important to enjoy what you're doing. So that's awesome. Yeah.
Thank you.
Okay. So what factors do you believe, so in Spokane, is there an adequate supply of food available?
Yeah, I'll tackle that first. And if you want to add, Carolyn, the answer is no, but yes. So, and I forget, did you tell me, you're from Washington State, right, Jennifer?
Yes. Yeah. I grew up in Warden, Washington.
Yeah.
Yeah,
So
really
we are so fortunate where we are because of the bounty, the agricultural bounty that we live amongst. So, I mean, if you drive, say, from here to Yakima or here to Tri-Cities, or, you know, between Yakima and Tri-Cities, I mean, there's just huge amounts of food being grown. Or we had a mobile market go to Waterville not long ago, or this week, and our truck driver, the guy who runs it, he just came back and said, you know, I hadn't been up there in a while, and I forgot how much grain is grown between here and Chelan. So is there enough healthy food available? No, we could use more. And at the same time, if I'm talking to, say, colleagues in the Detroit or New York or Ohio food bank, they are so jealous of us because of the produce and that we have access to. Again, about 90% of the food that we get is donated, whether from grocery stores, processors, and then farms. So, yeah. So is there enough? Nope, but we're better off than most. Yeah.
Yeah.
And we're very thankful not only to be in this area, but to the organizations, the stores, the farmers who donate to us.
Yeah. Yeah, and you're right. It's really important where you are at and the location you're in because, you know, like you said, the other people that you're serving or the other organizations you're with, they might not have the accessibility of all
Yeah,
the farms that we do. So I understand that.
yeah. I don't know if Carolyn, if you wanted to add to that at all, or
I don't think I have anything significant to add. Like, I do agree that we're richly blessed to live where we do. Isn't Washington like the #1 producer of lentils, which is just a powerhouse of a food? But the challenge is getting that into people's homes and then teaching them how to use those.
Yeah. And so what factors do you believe shape a person or community's access to healthy food?
go ahead and go first on that, Carolyn. Yeah.
Okay. There are so many factors that come to mind, both on the individual level and the community level. Like individually, one of the big things is just accessibility. Like, does a person have transportation to get food easily? Produce tends to be heavier than a lot of dry goods. So if they're walking or taking the bus, are they able to carry enough food for their families to take it home? Um, there's also just the education of the person and then putting them in an environment. Sorry, okay, let me start over. I forgot to mute my phone. So transportation, having access to grocery stores. A lot of times stores near you might not have pricing that's very fair, or sorry, they might not have pricing that is within your budget, and maybe the cheaper grocery stores are too far away and you can't get there easily. Maybe they're not on a bus route, maybe you don't have a car. There's also how you were raised and your just cultural and personal beliefs, and those might not be super in line with your doctor's recommendations, and it can be hard to navigate. Okay, well, this is what I grew up with and I want to honor these memories, but my doctor's telling me I need to eat this way instead. And so it's important to figure out how do we honor culture and also educate at the same time and compromise and say, like, all right, you're used to eating rice with every meal, how about we make that brown rice a couple of times a week? And then on the community level, it's really difficult if you are just excited about your personal health and then you drive home and you pass 10 fast food restaurants on the way. There's just so much messaging out in the world that may conflict with the changes that you're trying to make in your life. And so one of the things that we're involved with at Second Harvest is policy, systems, and environmental changes. And so that looks at affecting health on multiple levels. So we talk about the individual, but we also do work in the community and then try to affect policy change as well. And so various members of the Second Harvest staff serve on different coalitions and attend meetings that talk about changes like that and try to really just move our community forward any way that we can.
Awesome. Sounds so passionate. I'm really glad that, you know, you're educating the community and that you're so in love with what you're doing, and it really shows. Yeah. Did you have anything else, Eric?
No, I mean, I think Carolyn hit it very, very well. And, you know, I mean, to some degree, it's also up to each of us to make the healthy choices. Or
Okay.
I'm lucky I don't have a sweet tooth, so I I don't put a bag of chips in front of me, but yeah. Yeah, I mean, I think Carolyn hit it. There are so many different factors, but the ones are what are the ones that are closest to us? And again, a big factor is where we're at. We're very fortunate to have lots of really good healthy food. You know, something I don't think we've touched on, and Carolyn, you're probably better than me at this, but sort of the food as medicine notion.
So we partner with local healthcare organizations to try to promote healthy options for their patients and also pursue some research. Right now we're exploring how does increasing food access and nutrition education impact diabetes, and can we improve health outcomes there? So it's a really exciting thing to be a part of, and we're always looking for more ways to grow in that area and just like, how can we make this happen more? And we like truly believe that, you know, chronic disease which is so rampant in the community and especially among lower income individuals, can be greatly affected by nutrition. And so we're always looking for ways to impact specific communities and work with them to try to improve health outcomes for everyone in the community.
No, yeah, I agree. I think it's kind of sad when a cheeseburger is cheaper than an apple, you know.
Totally.
So I really agree with that. And I do think food is, you know, medicine, and with the right food you can be very healthy. So yeah.
Mm-hmm.
Yeah, is there anything else you guys want to say or have to say?
Well, first again, thank you so much for thinking of us and letting us chat with you about this and giving us a little bit of a spotlight. As appropriate, we're using every opportunity we can to say we need more food. I mean, 2 years ago, well, yeah, 2 years ago this time, or 18 months ago at this time, we were full, right? I mean, literally to get around parts of the warehouse, you had to back up and, shimmy against the walls. And now we've got empty racks, and there's all sorts of reasons for that, but we need more food. So we've added a new person whose job in Tri-Cities, whose job is strictly going out and procuring more food. 2 of Carolyn and my colleagues here who are in a different department have been told, hey, shift at least half of your time to figuring out how we can get more food. So
Yeah, of course. Yeah, and like I said, I really appreciate you guys taking the time to let me interview you and ask questions about your organization.